Around 2% of the global population has to deal with a condition known as Barrett's esophagus. Males over the age of 50 who live in developed countries are the highest risk group. It is estimated that the risk of developing esophageal adenocarcinoma amongst people with Barrett's esophagus is around 0.5 to 1% each year. This form of cancer is the 8th most common cancer worldwide. Published in the journal Gastroenterology and led by Professor Janusz Jankowski, a new study reviewed almost 12,000 papers on the care and treatment of Barrett's dysplasia and early-stage esophageal adenocarcinoma. The findings were analyzed using the Delphi process. The Delphi process is a novel method of analysis that allows researchers to attain an agreement on all reviewed papers' strengths of evidence. The goal is to use the findings as a means of recommending ways to manage these conditions in patients. This study is the first in its attempt to review all available research in this field. Professor Jankowski and his research team drafted statements on the diagnosis, epidemiology, methods of surveillance, treatment approaches, and prevention of high-grade dysplasia and early adenocarcinoma among patients with Barrett's esophagus. Using the Delphi process, they performed 4 rounds of anonymous voting on the statements until they reached a consensus in 81 of the 91 statements. Professor Jankowski concluded, "The key messages to emerge from this process are that the endoscopic equipment needs to be good, and that endoscopic surgery can be better than the more risky open surgery. In addition, there needs to be more and larger samples of tissue taken, so that the pathologist can make sure that no early cancers are missed."